Every day I want to see whether or not I could personally make a difference to our patients. It's quite an honour to think that something that we've done through Clifford Craig and the hospital has turned around to impact thousands and thousands of patients, and not just here now in Launceston, but in hospitals around the world who have implemented our research and are actively doing what we found worked. So potentially millions of patients are benefiting from research that was funded through the Clifford Craig Foundation.
When I started my job here in January 1997, and one of the main reasons why I came here was because of the funding which was provided by Clifford Craig Medical Research Trust then. I remember that it was a conjoint appointment, and they allocated like $50,000 over 2 years. So that was very attractive for me to come, and there is already funding so I can start my research projects. My work wasn't just about doing research. Through Clifford Craig also we played an important part in providing education, not just for the medical professionals, but also to the public.
Assistance of the Clifford Craig Foundation has allowed me to continue my work in neurological clinical trials, particularly in motor neurone disease and multiple sclerosis, which are two of the areas that I work primarily in. And it's allowed me to bring some clinical trials to Tasmania that haven't been done here before, which ultimately means that people have access to different sorts of treatments that they might not be otherwise able to access. When someone's living with an incurable illness like motor neurone disease, being involved in clinical trials gives us hope. Hope that we can make that individual's disease better or slow down the progression of their illness, but also hope that they can be part of something that's bigger than their own illness and bigger than their own journey through it.
The Clifford Craig Foundation has been very generous to me over the years that I've been here. In particular, they allowed me to set up the Tasmanian Vaccine Trial Centre, and I've been able to run a series of studies out of that centre. And the money and the support from them has allowed me then to apply for competitive funding at a national level and get considerable funds to do the kind of research I like doing. So I would of course never have anticipated when I first came here that we would have had a pandemic to face. It has been unbelievable, very difficult, very challenging, very tiring, but also very exciting to be involved in so much pandemic preparedness. I've been very involved in national vaccine policy from a COVID vaccine point of view, and locally helped a lot in the LGH preparations for COVID and how to manage it. So it's been a challenge, but I think in some ways my background and training was a really good preparation to deal with something like this and to bring my skills into use.
I'll tell you, last 30 years it went so fast because it has been so active. And look at how my research has evolved through the research fundings. We started with risk factors for Alzheimer's disease, and then we moved on into treatment for Alzheimer's disease.
I think the most important thing is that the Clifford Craig Foundation grants have been driven by ideas and questions we have that are directly relevant to the patients here at the Launceston General Hospital. And I love the fact that the Clifford Craig Foundation is funded by the community through donations, and those donations that get flipped around and turned into research activities that can directly impact the community we serve. And so it's a very unique position to have that direct link between community giving and community receiving.
I think it's hard if you're not a researcher or working within the hospital setting to imagine the impact that it has, not only for the clinicians themselves to be able to be satisfied with their jobs and do amazing research, but also these have translational implications which hopefully will improve the health of people, both in Tasmania but also Australia and the whole world. And so research has to be done to progress medicine, and it's very great that we can actually do that at Launceston General. So thank you.